Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pain medication for arthritis. Arthritis refers to a group of diseases that result in joint inflammation and chronic pain. In the United States alone, arthritis affects about 58.5 million adults. Zeroing in further, 24 million reported that their ability to carry out daily activities is limited by the condition, while 1 in 4 adults said their arthritis has left them with severe pain. Usually, a combination of medications are used to treat the pain and discomfort caused by arthritis. Here is an overview of the different classifications of pain relievers prescribed to treat arthritis pain, from weakest to strongest. /r/n/r/nMorsa Images, Getty Images /r/n/r/n Acetaminophen is a non-opioid analgesic used for mild to moderate pain. It is also an antipyretic that can lower a person's fever. This drug is an active ingredient in countless over-the-counter medications and prescriptions, including Excedrin, Tylenol, and Tylenol arthritis. It is commonly used for arthritis relief because it doesn't possess the same heart and gastrointestinal risks of NSAIDs. It's seen as a safer alternative. /r/n/r/n Unfortunately, acetaminophen isn't an anti-inflammatory medication. The swelling and inflammation reduction that is a feature of NSAIDs is not available with acetaminophen. /r/n/r/n Acetaminophen products bear warnings of severe liver damage, allergic reaction, and overdose. The Food and Drug Administration, FDA, issued a directive in 2011 to limit acetaminophen in prescription drugs to 325 mg per pill. Additionally, they stated that drugs with acetaminophen should feature a boxed warning label highlighting the potential for severe liver injury. /r/n/r/n Nonsteroidalantiinflammatory pain medications, NSAIDs are the most commonly prescribed drugs to treat inflammation and pain from arthritis, bursitis, and tendonitis. They can be taken by mouth or rubbed over joints. NSAIDs prevent the enzyme cyclooxygenase, COX, from creating prostaglandins, which are hormone-like chemicals that play the biggest role in inflammation. The body makes COX-1, which protects your stomach lining, and COX-2, which contributes to inflammation. /r/n/r/n Many NSAIDs impact both forms of cyclooxygenase, combating inflammation but also contributing to bleeding in your stomach and ulcers. There is a targeted form of NSAID, COX-2 inhibitor, that block the inflammation-causing enzyme more than the stomach-protecting one. Celebrex, celecoxib, is the only COX-2 inhibitor available in the US market. /r/n/r/n Here's an overview of some common NSAID options. /r/n/r/n Side effects of NSAIDs may include /r/n/r/n corticosteroids, or steroids, are a type of drug that can suppress the immune system and reduce inflammation. They are prescribed to treat rheumatologic conditions, including rheumatoid arthritis. They come in different forms. SOMA may be applied to a specific site of pain, such as joint injections or skin creams, while others like oral and 4-steroids work systematically. /r/n/r/n Below is a list of common corticosteroids from weakest to strongest. /r/n/r/n Side effects increase with the dose and may include /r/n/r/n increased blood sugar or diabetes, hypertension, bone mass loss or osteoporosis, and gastritis are also possible. Consult your healthcare provider if you experience more serious side effects like blurred vision, seizure, or unusual mood changes. /r/n/r/n Opioids are powerful painkillers, analgesics, that block pain signals to the brain. All natural opioids are derived from the opium poppy plant, but synthetic opioids like fentanyl are made in a lab. They are prescribed by a healthcare provider or medical professional to be used as part of a carefully supervised pain management plan. Some opioids like heroin are illegal substances. Opioids can lead to addiction and, if misused, can result in a fatal overdose. /r/n/r/n This class of drugs has long had a role in treating surgical and cancer pain. In recent years, they've increasingly been prescribed for chronic pain from arthritis. For example, up to 40% of rheumatoid arthritis patients are regular opioid users. The use of opioids for this type of pain remains controversial, however, and the benefits of these medications are unclear. /r/n/r/n Here's a list of opioids from weakest to strongest. /r/n/r/n It's important to take these medications exactly as prescribed. They can cause serious, life-threatening breathing problems, most likely during the first 72 hours of treatment and at any point when dosage increases. Your healthcare provider may need to carefully monitor your use of the drug. /r/n/r/n We are living through a national opioid addiction crisis in the United States. In 2020, almost 75% of drug overdose deaths involved an opioid. When an opioid overdose is suspected, naloxone hydrochloride should be administered as soon as possible to reverse the effects of an overdose. /r/n/r/n Naloxone hydrochloride nasal spray is currently available both over the counter and by prescription, under different brand names. Prescription options include Cloxxardo, 8 mg/spray, Rixavi, 4 mg/spray, and Rezenapy, 10 mg/spray. Narcan, 4 mg/spray, and Revive, 3 mg/spray, are brand names available OTC. /r/n/r/n The chronic pain associated with arthritis can be debilitating and limiting. It can hinder your ability to carry out normal daily tasks and go about your life with ease. That's why it's important to seek the treatment that's right for you. While many medications can offer pain relief, they each come with specific recommendations and risks. Whether you are looking for short-term pain relief or more robust long-term treatment, be sure to discuss with your medical provider what the best medication regimen might be for you. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.